Hey friends, welcome back to Eye Health Central. I'm Dr. John Legaretta, a board-certified ophthalmologist. Today, we're exploring a topic that many of you asked about, ocular migraines. Have you ever suddenly seen strange lines or blurs in your vision that appear out of nowhere? Or maybe you've experienced a temporary vision loss that has freaked you out. You might have had an ocular migraine, and that's exactly what we're talking about today. I will explore what ocular migraines are, why they happen, and how to know if you've had one and what to do if it happens again. If you're new here and want to live your healthiest life and boost your knowledge about eye health, don't forget to hit that subscribe button and hit the bell icon so you won't miss any of the new videos. Let's get started and unravel the mystery of ocular migraines together. Whether you're a longtime sufferer or just curious, this video is for you. Let's dive into our first segment, understanding exactly what ocular migraines are. This condition might sound simple, but there's quite a bit to unpack here to really grasp what's happening when an ocular migraine strikes. An ocular migraine is a term that can sometimes confuse even those who've experienced them often. Officially, it refers to a migraine that includes visual disturbances called aura, which it can affect both eyes. These disturbances usually are visual, but also include sensory disturbances as well. Importantly, ocular migraines differ from visual auras in regular migraines by the type and extent of the visual symptoms. The visual symptoms of an ocular migraine are particularly striking. Imagine suddenly seeing shimmering or flickering lights, zigzagging lines across your field of vision, or patches of missing vision that grow and spread across your sight. These symptoms usually appear gradually over several minutes and usually affect both eyes. Many people confuse ocular migraines with similar terms like retinal migraines. Here's the key difference. Retinal migraines are altogether separate condition that affects only one eye and can sometimes lead to temporary blindness in that eye, which can be quite alarming. On the other hand, ocular migraines typically impact both eyes and don't lead to complete blindness. Another confusion is between ocular migraines and migraine with aura. While both conditions involve visual symptoms, the auras in a migraine typically precede the headache phase and are sometimes followed by a headache that can last for several hours to several days. In contrast, ocular migraines might not always involve significant headache pain. To get a little bit deeper, the aura in ocular migraines involves changes in the brain's electrical activity spreading across the visual cortex. This activity starts in one region and moves across the area, leading to the visual disturbance many describe. Scientists used advanced imaging techniques to observe these changes during a migraine, although the exact trigger for these shifts in brain activity is still under research. The symptoms in an ocular migraine usually last between 5 to 60 minutes and might not need any treatment to resolve by themselves. Most people find that resting their eyes and avoiding bright lights can help lessen the discomfort until the migraine passes. Understanding these symptoms and their impact can help you better manage an ocular migraine if it happens. It's also crucial for distinguishing ocular migraines from other serious conditions that require immediate medical attention. But what exactly triggers these ocular events? Let's find out in the next section, where we will explore the common triggers of ocular migraines. Now that we have a good grasp of what ocular migraines are, let's talk about what you might experience during an episode. Understanding these symptoms can help you recognize an ocular migraine quickly and manage it effectively. The most notable symptoms of ocular migraines are visual disturbances, or what we call auras. These can vary widely, but typically include a mix of unusual visual effects. Let's break this down. Flashes of light. You might see what looks like flashing lights that can be very distracting or even disorienting. Zigzag lines. These lines may appear to move across your field of vision, often shimmering along their path. Blind spots. Some areas of your vision might disappear temporarily, which can understandably be quite alarming. While visual symptoms are the most common, ocular migraines can sometimes involve other sensory disturbances as well. This might include tingling or numbness in one part of your face or body, or perhaps a feeling of pins and needles. These symptoms usually develop gradually and can last from a few minutes to over an hour. It's rare, but they can linger longer. Most people find that lying down in a dark, quiet room can help the symptoms pass more comfortably. It's important to note that not everyone will experience a headache with an ocular migraine. However, when headaches do occur, they typically come on after the visual symptoms and sometimes can be quite severe. This headache might feel like a pulsing or throbbing pain on one side of your head. The severity of these symptoms can vary, but they often affect your ability to perform daily tasks, especially activities that require sharp vision and focus, such as driving or reading. That's why recognizing these signs early on is so crucial. Having looked at what ocular migraines might feel like, let's delve into what can actually trigger these episodes. Understanding the why behind these visual disturbances can empower you to manage your symptoms better and might even help you prevent them. Ocular migraines, like other types of migraines, don't have a single cause, but are instead triggered by a variety of factors. Each person's trigger might be different, making it a bit of a personal detective story. Stress. Perhaps the most common trigger, stress, can cause changes in your body that precipitate a migraine. Managing stress through meditation, yoga, or simply taking time to relax can significantly reduce your risk. Diet. Certain foods and additives are known triggers. These include aged cheeses, processed foods, artificial sweeteners, and foods high in nitrates or monosodium glutamate. Keeping a food diary can help you identify and avoid your dietary triggers. Caffeine and alcohol. Both excessive caffeine and alcohol intake can trigger ocular migraines for some people. Conversely, cutting down on caffeine can also be a trigger if your body is used to a high level. Bright lights and screen time. Flashing lights or bright lights, including digital screen glare, can provoke migraines. Considering using anti-glare screens or blue light filters to mitigate this risk. Beyond external triggers, there are also physiologic changes that can lead to ocular migraines. These might include hormonal fluctuations, particularly in women during menstruation, pregnancy, or menopause, and changes in sleep patterns or irregular sleep. Environmental factors and conditions such as weather changes, high altitude, or even strong odors can also trigger an ocular migraine. For those sensitive to such changes, monitoring weather forecasts and avoiding known irritants can also be helpful. Identifying your specific triggers can be incredibly beneficial. I recommend keeping a detailed migraine diary where you note down when migraines occur, as well as what you ate that day, how much stress you were under, and any other environmental factors that were present. Over time, patterns may emerge that can help you avoid potential triggers. All right, we've talked about what ocular migraines are and what might trigger them. Now let's get into how these are actually diagnosed. Diagnosing ocular migraines can sometimes be a bit tricky, as it primarily involves ruling out conditions that can cause similar symptoms. When you visit your doctor with symptoms that might suggest an ocular migraine, the first step is usually a detailed discussion about your symptoms and medical history. You'll need to describe what you experienced during an episode, including the type of visual disturbances, their duration, and whether they're accompanied by any other symptoms like headaches or sensory changes. Your doctor will also review your overall medical history to check for any risk factors or conditions that might contribute to ocular migraines. Based on the initial discussion, several tests might be conducted to further investigate the symptoms and rule out other causes. Examples of some of the diagnostic tests include an eye exam. A comprehensive eye exam can help ensure that the symptoms aren't due to issues within the eye itself, such as a retinal attachment. A neurological examination may also be performed, and this includes tests to check your reflexes, muscle strength, muscle tone, sense of touch and sight, and coordination. And then finally, some imaging tests may also be performed, like an MRI or CT scan, to rule out other neurological disorders. Getting an accurate diagnosis is crucial because it ensures that you receive the right treatment and can effectively manage your condition. It also helps to rule out any serious underlying issues that can be causing the symptoms. All right, folks, that wraps up our deep dive into ocular migraines. I really hope this video has shed some light on what ocular migraines are, how they manifest, and most importantly, what you can do about them. Remember, while they can be unsettling, they're generally not harmful in the long run and can often be managed effectively with the right approach. If you do experience symptoms of an ocular migraine, it's a good idea to consult with a healthcare professional just to rule out any other potential issues. And once you've got a handle on what triggers your migraines, you can start to take control back and reduce the frequency of these episodes. I'd love to hear from you. Have you ever experienced an ocular migraine? What was it like, and what strategies have you found helpful in managing them? Let's build a community of support right here, so drop your experiences and tips in the comments below. Sharing is caring, and your insights could really help someone else out. And if you found this video helpful, please give it a like, hit that subscribe button, and click the bell icon so you never miss out on our upcoming videos. We've got lots of great content coming your way that you won't want to miss. Thanks for watching, and always keep learning, keep growing, and take care of your eye health. Catch you in the next video.